flat. My tummy's flat again. My hips are flat.
Dee doesn't want her face or real name on TV. She says she wants to keep her recent body-shaping changes a secret. But she's happy to talk about the two-step liposuction procedure she says made her stomach and hips smaller, but her bust line bigger.
It's mostly up here, more volume up here, which is what I lost from breastfeeding.
Can you please check the schedule?
Dr. Thomas Young calls it natural breast enhancement and says it increases breast size by 1 or possibly 2 cup sizes. Dr. Young uses water-assisted liposuction like this to remove fat from trouble spots on the hips, thighs, or abdomen. The fat is then transferred to about 100 syringes and then injected into the breasts.
It's permanent, it's safe, it's your own tissue. You're not getting something foreign put in that's going to cause a scar that's going to need to be replaced.
According to the American Society of Plastic Surgeons, breast augmentation is the most commonly requested procedure among women. Dee says she considered implants, but quickly ruled out the surgery.
Too many risks, and I felt like I would look into the mirror and I wouldn't see me. I would see something fake, and I didn't like that. I didn't like the idea.
Dr. Young says the technique isn't new, just improved. He says doctors are better at keeping fat cells alive during the transfer, and that 85 to 95% survive the move.
We put it in small quantities, so it's not in a big injection, which was one of the older techniques. They would put in a big area. And what happens is the body just forms new little blood vessels to feed those fat cells. And it happens fairly quickly.
Here is Dee before and 3 days after the procedure. Here she is from the side before and after. This was taken during the fat transfer. You can see more volume in the completed breast on the left.
It doesn't give you the lift. You know, it gives you the illusion of the lift because we're putting volume in the upper part, but it's not actually going to lift. So if you have a lot of droopiness, you're still going to need that surgery.
Dr. Young says women can still breastfeed after the fat transfer. A new 5-year study of the procedure finds it does not obscure mammography or interfere with cancer detection. But Dr. Young does not recommend it for women with a family history of breast cancer who need more frequent screenings. Another downside is that breast will get smaller if you lose weight. But if you add fat,
it's going to act like the fat tissue that it came from. It's going to be the stubborn stuff that you couldn't get rid of in the first place. So it's going to be stubborn to get rid of when we put it up here.
The best part about it is, he wanted me to maintain my weight and even gain a few pounds. And, when I gain weight, that's where I should gain it, not here.